everybody. I just wanted to give a quick update. On last Monday, I went to the local ER for IV fluids. I know I had just gone on Friday, but I wasn't able to put anything through the J port of my GJ tube, so we went to the local ER for fluids. My caseworker had to kind of drag me kicking and screaming. I didn't really want to go. But anyway, we got there and I got a bolus of fluids, which really wasn't enough to rehydrate me, but it would have done. It would have been fine with me. And since it was, looking like I was going to be sent home, my caseworker left. And then this nurse walks into my ER room and she's like asking all these really leading questions. And I'm like, oh no, I know exactly where this is going. And I was way too tired to give the right answers, because everyone that has ever had a psych history knows the right answers to these questions and the definitely wrong answers to these questions. And since I was so sick on Monday, I probably said something, I don't know, but she totally ran with it, misconstrued it as, oh no, you're suicidal. And I'm like, no, I didn't say that. You're twisting my words around. But as soon as they make their mind up that you're suicidal, well then, your psych history automatically, you're not credible anymore. So they take the ball into their own hands. And basically, if a doctor walks into the room and says, you have the option of either going in voluntarily or being committed, I would definitely recommend going in voluntarily because it looks a lot better. You'll probably get out faster. But anyway, they were getting ready to ship me off somewhere, either to the local psychiatric unit or the one up in Columbia. And well, they wouldn't take me because of my feeding tube. And so I'm like, score, awesome. But then the ER doctor found out that I'd been falling at home due probably to malnutrition and the dizziness that induces and everything. So then he changed his story to, oh, she can't go home because she's falling. So then they were looking for a medical admit for me, and they called my primary, and my primary said, bring her up here, So they brought me up to Columbia, and I was hospitalized. I was in this, it's called the sitter room, and it's basically for psych patients with medical complications. And it's kind of like that limbo place where you're too sick to go to the psychiatric unit, so they try to make you feel a little bit better. My roommate was having blood sugars in the 500s, and so they wouldn't admit her until they could get her sugars down in the 300 range, which is still pretty bad for diabetes, but I guess that's what their goal was. I don't know. But anyway, they did some tests, and they found out that I indeed had an infection in my intestines called C.diff. And then they were like, oh, that's why you've been having pain. And I'm like, really? This whole time I was saying, I'm hurting, and all they just kept saying was, well, you shouldn't be, but that didn't make me hurt any less just by them saying, well, you shouldn't be hurting. So when they found that, they, then all of a sudden there was a plan, GI came in to see me, surgery came in to see me, a lot of different doctors. My attending this time was fantastic. She had just been a resident and has only been attending for a couple of weeks, and took her fresh perspective to see what test hasn't been run yet. And so it was a stool sample. That's how they diagnose C. diff. And I know that sounds totally gross, but there you go. Anyway, so I was sent to a private room, and a private room in a hospital, in a hospital that has what they call semi-private rooms, is not necessarily a good thing, because it means that you're really sick, and with this infection, if someone else has a compromised immune system like I do, they could get sick. So that's why the private room, and all the nurses and doctors had to wear those sterile gowns and gloves when they came into my room, just in case, they would spread it to another patient. So you definitely didn't want that. And they started me on Flagyl on Tuesday, IV. Everything was IV. I couldn't handle anything in my tube at all. And then Friday, we restarted feeds after 2 weeks of not being on them, and it was a world of difference. I'm feeling much better now. Able to get my hydration in, able to, get my feed rate up to 45 cc's an hour. The goal rate on the discharge paperwork said 50 cc's an hour, which is 1,800 calories a day. But my doctor talked about 80 cc's an hour, which is 2,800 calories a day, which was what I was on when I was doing well. So, I don't know, I just require more calories than what's normal to maintain a healthy weight for some reason. I don't know why. And it gets kind of uncomfortable even at 45, so I'm just going to keep it really slow and everything and take it, slower. I'm kind of hyperactive by nature, so my idea was, oh, I'm going to go to the gym. I'm going to, do this. And I'm like, well, I don't really want to wear myself out either. So I might just not go to the gym this morning, even though, like, I really want to. Still haven't made up my mind, and I've still got a couple hours to make up my mind because it's still the middle of the night. So anyway, I just wanted to check in and tell you guys that I'm doing okay. And yeah, I'm just really glad they found this. I'm really glad that there was an answer. I'm glad that they didn't send me away again saying, well, maybe it's a psychosomatic issue, whenever it obviously is not a psychosomatic issue. Not being able to feed yourself. I mean, I do have a history of eating disorder. You guys know that already. But there is a stark difference between, eating disorder, restricting, and not being able to get the nutrition you need whenever you're not in that space. And it's incredibly painful and scary. So anyway, I'm glad that I can quit tearing my hair out over the mystery pain now that we have it figured out. I have 9 more days of the Flagyl antibiotic, and then in 3 weeks I'm scheduled with surgery about a possible Roux-en-Y J-tube placement, since this is going to be long-term, probably for the rest of my life, unless something really miraculous happens. Because the GJ tube is, I guess, temporary, and right now it's falling apart and super gross. But they were going to change it while I was in the hospital, but they can't touch it with the C.diff, so I understand that. But a friend of mine was like, well, maybe you got the infection whenever they put the tube in. It makes kind of sense because it was done in interventional radiology under conscious sedation, which is crazy because you're still awake while they cut into you and everything, and it sounds horrifying, but they messed me up big time on fentanyl and Versed, so I was really feeling no pain. The most uncomfortable part was when they were doing the local anesthetic in my abdominal area. But then other than that, I was chatting with the doctor that was putting the tube in the whole time. Granted, I don't remember what I said at all, so that kind of worries me a little bit. But for the Roux-en-Y J tube, it'd be definitely under anesthesia. I've had a direct J tube before, and that was also under general anesthesia. In fact, I don't know why they chose to do the IR route for my GJ tube, but there you go. I guess that's standard, but I was really too sick to, object. And they do a good job of making sure that you're not in pain. So, because they know that tearing into flesh hurts. Just that simple. But anyway, I'm going to go, and I hope you guys have a great rest of the day. All right, thanks. Bye.